If you're over 60 and you think it's normal to sleep little, wake up several times at night and feel tired all day, I need to tell you something. This can be more dangerous than it looks. Today I'm going to show you 5 serious problems that lack of sleep can cause in a man over 60. Problems with the heart, memory, balance, mood, and the body's defenses. Stick with me until the end, because I'll also tell you when it's time to seek professional help, and what is myth when we talk about sleep in older age. As we age, it's true that our sleep pattern changes. Many people start to go to bed earlier, wake up earlier, or have lighter sleep. But that doesn't mean that older people need less sleep. Recommendations usually stay around 7 to 8 hours of sleep per night for older adults with good quality. The problem is when you sleeps 4 or 5 hours per night almost every day, wakes up exhausted, irritable, with no energy, or spends the whole day sleepy, nodding off against his will. Research has shown that this pattern of poor sleep in older people is linked to more heart disease, more falls, more depression, and more memory problems. And that's what we're going to talk about now.
First point, the heart. Several studies show that people who sleep too little or have very fragmented sleep have a higher risk of high blood pressure, heart attack, and stroke. Why? During sleep, the heart and blood vessels take the chance to slow down. Blood pressure usually drops a bit, and the body goes into maintenance mode. When sleep is short or broken, this nighttime checkup doesn't happen properly. In older adults, this weighs even more because there is already a higher chance of cholesterol, high blood pressure, diabetes, and the body doesn't have the same reserves it had at 30 or 40.
Sleeping badly for a long time is like driving with your foot half pressed on the accelerator 24 hours a day. It's no surprise that poor sleep in older adults appears associated with cardiovascular disease and even higher mortality in some studies. If you know someone over 60 who always says, "I sleep badly, but I'm fine," send this video to them.
Second point, which worries a lot of people, memory. The brain uses sleep to organize memories, clear away waste, and consolidate what you learned during the day. Studies in older adults show that sleep problems, especially chronic insomnia and very fragmented sleep, are associated with a higher risk of cognitive decline and dementia over the years. That doesn't mean that if you sleep badly, you will get dementia, but it does tell us that poor sleep is a risk factor we can work on.
So, what can happen to a man over 60 who has sleep problems? More forgetfulness of recent events, difficulty concentrating, slower thinking, and a feeling of heaviness in the head throughout the day. Taking care of your sleep after 60 is also taking care of your mental health for the future.
Third problem, falls. Several studies with older adults show that people with poor sleep, insomnia, or very short sleep have a higher risk of falling. Why? The body wakes up already tired. Attention and reflexes get worse. Muscles can respond more slowly. And often, sleep medications are added, which can also cause dizziness and drowsiness.
The result? A stumble that might have been just a scare at 30, at 70, turn into a fall with a hip fracture, surgery, and loss of independence. If you're over 60 and are always tired, feel dizzy, doze off anywhere, or take sleeping pills every night, talk to your doctor about sleep and fall risk. This is serious, and a lot can be prevented.
Fourth point, mood. Poor sleep and depression walk hand in hand, especially in older adults.
Studies show that insomnia and poor sleep quality almost double or even quadruple the risk of depression in older people.
Usually this shows up as lack of energy, irritability, loss of pleasure in things he used to enjoy, isolation, a feeling that nothing makes sense. And here's an important detail. Older adults don't say, "I'm depressed." They say, "I'm just tired. It's age. I don't feel like doing anything anymore." If you see an older relative sleeping badly and becoming more and more sad, closed off, or irritable, this is not weakness. It deserves attention and, if possible, professional evaluation. Taking care of sleep can be part of depression treatment. Just as treating depression can improve sleep, it goes both ways.
Fifth problem, the immune system. At any age, poor sleep affects our immune defenses. In older adults, this is even more delicate. Research shows that sleep deprivation changes immune cells, increases inflammation in the body, and is linked to a higher risk
Of cardiometabolic diseases, infections, and even some neurodegenerative conditions.
In simple terms, it's easier to catch infections, it's harder to recover, and the body lives in a state of low-grade, constant inflammation, which isn't good for anyone, especially not for those who already have high blood pressure, diabetes, or arthritis. So when a 60, 70, or 80-year-old man says, "I'm always getting sick, one thing after another, and I sleep really badly," sleep needs to be part of the conversation with the doctor, along with medications, diet, and exercise. Okay, but when is it really time to seek help? Some red flags. You sleep badly almost every night for months. You feel tired all day long. Keep dozing off everywhere without meaning to. Feel your memory and thinking have gotten much worse. You've fallen or almost fallen several times because of dizziness or sleepiness. Your mood has changed a lot. More sadness, irritability, loss of interest. Snore very loudly or stop breathing sometimes. Your family notices this. If one or more of these are happening, it's not just age, and it's not overreaction. It's worth booking an appointment with a doctor, preferably a geriatrician, cardiologist, neurologist, or sleep specialist, depending on your situation. That's why I'm going to walk you through what not to do in the 2 hours before you go to bed. First mistake, and you probably do this, staying glued to your phone, TV, or computer until you literally pass out. The light from those screens, especially blue light, sends a message to your brain. It's not time to sleep yet. Stay awake. That gets in the way of melatonin production, the hormone that helps you fall asleep, and makes you take longer to drift off, or leaves you with a much lighter, more fragile sleep. And it's not just the light, it's the content. Bad news, social media arguments, fast-paced videos, competitive games. All of that keeps your brain in alert mode instead of rest mode. What can you do instead? Giving yourself 30 to 60 minutes without screens before bed already makes a huge difference in your sleep quality. Second common mistake: coffee or energy drinks too late in the day. Caffeine takes several hours to be fully broken down. If you drink coffee, black tea, chimarrão, caffeinated soda, or energy drinks in the late afternoon or at night, it's like trying to sleep with someone poking you the whole time. That can make you take longer to fall asleep, wake up several times during the night, and have a lighter sleep that doesn't truly restore you. And remember what we said earlier: the worse your sleep, the more chaos inside your body, and the higher your chances of cardiovascular problems. Practical tip: if you're sensitive, try setting a cutoff time for caffeine. For a lot of people, after about 3 or 4 p.m., it's already risky if your goal is to sleep well. Third mistake: eating a heavy dinner too late. When you load your plate with fried food, fat, sugar, soda, right before bedtime, your body gets split. Do I rest or do I try to digest this truckload of food? The result? More fragmented sleep, heartburn, reflux, discomfort, and in many people, worse snoring or even more intense sleep apnea, all of which also affect your heart. Practical tip: try to keep dinner lighter and leave a good gap before you lie down, something like 2 to 3 hours. And if you do get hungry close to bedtime, go for a light snack instead of a heavy meal.
Fourth mistake.
That famous little drink to relax before bed. A lot of people feel that alcohol helps them knock out faster. But what we actually see is the opposite. Alcohol may make it easier to fall asleep, but it wrecks your sleep quality later, leaving your night fragmented with more awakenings and less deep sleep. And again, this stacks on top of other risk factors for your heart: weight gain, worse blood pressure control, higher triglycerides, more inflammation in the body. It's not about never drinking anything ever again. But if alcohol has turned into your sleeping pill, it's time to turn on the warning light. Fifth mistake: turning your bed into an office, a meeting room, or a boxing ring. If every time you lie down it's to answer work emails, solve money problems, argue about your relationship over text, your brain starts to associate the bed with tension, not with rest. The result is lighter, more superficial sleep with more awakenings, and that feeling of waking up already tired, as if you hadn't really slept. In the long run, this lack of recovery helps keep your stress hormones higher, and those are also linked to high blood pressure and a higher cardiovascular risk. Now I want to hear from you. Of all these mistakes, which one hits you the most today? To wrap up, keep this close to your heart. It's not just about sleeping whenever you can. Sleep is taking care of your heart, your hormones, and your quality of life. If you're over 60, remember this: sleeping well is not a luxury. It's one of the ways to protect your heart, your mind, your balance, your mood, and your body's defenses. And if you're a son, daughter, grandson, or granddaughter, maybe one of the greatest acts of care you can offer today is to help that older man in your family take his sleep seriously. Now tell me in the comments, are you over 60, or do you take care of someone who is? And from 0 to 10, how would you rate your sleep quality today? If this video helped you understand the dangers of sleeping too little after 60, leave a like, subscribe to the channel, and share this video with someone in your family who deserves to age with more health. I'll see you in the next video. Sleep well and take good care of your health. Whew.